ਇਸ ਕਰਕੇ
ਹਾਂਜੀ
ਮੈਂ 2 ਮਿੰਟ ਲੇਟ ਹੀ ਬੋਲਦਾ।
ਕੋਈ ਗੱਲ ਨਹੀਂ, ਹੋ ਜਾਂਦਾ ਜੀ, ਚੀਮਾ ਸਾਹਿਬ ਦਾ ਪਤਾ ਚਾਲੂ ਹੋ ਜਾਣਾ, ਫਿਰ ਬੰਦ ਕਰਾਉਣਾ ਔਖਾ ਹੁੰਦਾ। ਜਿੰਨਾ ਮਰਜੀ ਕਹਿ ਲਓ ਵੈਲਿਊਮ ਘਟਾਣਾ, ਨਹੀਂ ਘਟਾਉਣੀ ਵੀ ਅੱਖ ਕੇ ਲੱਗਣਾ ਨਹੀਂ, ਇਹਦੇ ਨੇੜ ਨਹੀਂ ਹੁੰਦੇ, ਜਿੱਦ ਕਰਨਾ।
ਪਰ ਚਲੋ ਮੈਂ ਇਸ ਕਰਕੇ ਮੈਂ ਆਖਿਆ ਵੀ ਉਹਨਾਂ ਦੀ ਗੱਲ ਪੂਰੀ ਹੋ ਗਈ ਹੋਣੀ, ਮੈਂ 2 ਮਿੰਟ ਲੇਟ ਕਰਦਾ।
ਇਹ ਅੱਜ ਤਾਂ ਆਪਾਂ ਛੁੱਟੀ ਕੱਲ ਕੀਤਾ ਸੀ ਆਪਾਂ।
ਹਾਂਜੀ
ਕੱਲ ਕੀਤਾ ਸੀ ਆਪਾਂ।
ਅੱਛਾ ਕੱਲ ਕੀਤਾ ਸੀਗਾ।
ਹਾਂਜੀ ਹਾਂਜੀ।
ਸੋ ਚਲੋ ਠੀਕ ਹੈ, ਫਿਰ ਬੰਦ ਕਰ ਦਿੰਦੇ ਆਪਾਂ।
ਕੱਲ ਨੂੰ ਕਰਾਂਗੇ।
ਓਕੇ ਇਟਸ ਓਕੇ ਓਕੇ ਓਕੇ
ਠੀਕ ਹੈ ਜੀ।
Health Education Lecture Series. I am your host, Gurdeep Singh Sandhu, homeopathic consultant. I am here to deliver another lecture of Health Education Lecture Series for all of you. Those who are listening in English, today it will be in English and tomorrow it may be in Hindi or Punjabi, whatever it will be. But today I would like to explain the other lecture of chest contents. Mainly in the chest contents, we have discussed about the heart, main important things, but still there is detail. Many things we have to discuss: encephalitis, pericarditis, valvular diseases, and many other things there are. We will go for details of those ones. But mostly, I discussed with you that these are the most important signs of chest organs defects outwardly, so that you can outwardly judge that what is going on inside my chest and what will be the main organ affected with any problems. So in that way, then after that we have started discussing a separate portion of all these, and we discussed about the heart, and after that we discussed about the mediastinum. And as I told you, the mediastinum is about 8 centimeter approximately, 8 centimeter wide from sternum, from the front bone, the chest bone, that's known as the front bone, to the vertebral column. So it's just like you can say it's a partition from sternum to vertebral column. It's a partition, and that partition, that wall, is about 8 centimeter wide. And that wall, that's known as the mediastinum, from upward, this starts from the sixth vertebral, this then the vertebrae, sixth backward, from the backside, from the vertebral column, if you measure it, from the sixth vertebral vertebra, and in front from the manubrium sterni, the superior portion, upper wala portion, superior portion of the manubrium sterni, and downward it is up to the 11th thoracic vertebra from the back side, and up front it is up to the xiphoid process. So this is what the measurement of the mediastinum was. After that, upward it is united with the neck, downward it is united with the abdomen, and that description has already been given to all of you. And after that, we were discussing the major important organs of this mediastinum, and we discussed about the esophagus. I have given you the details of esophagus, how it is structured, how it is formed, from where it starts from upward and goes downward to this up to the stomachs, and when it passes from the diaphragm, uh, and what are the constrictions, you can say the strictures you formed inside the diaphragm, inside the esophagus, and just like twisted, it is twisted to right side, twisted to left side, like this one. And ultimately all the constrictions, upward superior constriction, which is when it is starting from the pharynx and the tracheal portions, and that you known as the epiglottis area, and downward up to the diaphragmatic constriction, diaphragmatic orifice, you can say, from where it passes into the abdomen. So that I have given to you, and the measurement, the total measurement is about 25 centimeter to 10 inches approximately. And out of that, the 3 centimeter approximately lies in the neck, because from the back side it starts from the six cervical vertebrae, and in front a little bit we see, you can see that it is from the notched of the manubrium sterni here, and ultimately goes downward about 20 centimeter downward, and it passes from the diaphragm, and there are still 2 centimeter approximately remains when it attached to the stomach, and that end is known as cardiac orifices. So this is what I have given you, the structure of the esophagus, and the formations, and whereas the structural formation I told you about, that one it has about four different layers. The first one is the mucus layer and the submucous layer, then the muscular layer. That muscular layer was having two types of muscle fibers. Inner fibers are circular, and outer fibers are the long longitudinal fibers. And above that, there is a connective tissue thin layer which separates it from the other parts of the mediastinal or areas. So after that, problems and everything about this, you can say the diaphragm, I have told you, because many of the things which are indicators that something else, but they are related to the internally from the GIT, gastrointestinal tract, and also to the esophagus. The main of the thing, just like I told you, the stiffness in the neck. When you wake up in the morning, you feel stiffness in the neck, and you are trying to say that it is because of the pillow, it is because of the rheumatism, it is because of something else, any injury or anything else. But there is one main reason behind that, that is the gastric GIT problems, or indigestion, acidity, GERDs, you can say. So all these things are I have described in my previous lecture of English regarding this. And after that, we have discussed about the uh, blood vessels, blood vessels passing from the mediastinum. No doubt, cardiac heart is also a portion of the mediastinum, but it is separated from that by the pericardium membrane, just like the connective tissue membrane I told you about the esophagus. The same way, the pericardium membrane is covering the heart area and separating it from all other organs passing through the mediastinal pathway. And I told you about the four chambers of that one. I told you about the foramen ovals of that one, and I told you in the mother's womb, when the pulmonary artery was not working, and the lungs were flexed, though they are spongy organs, but they are flexed. They were not able to work. They are not able to take oxygen. They are not able to collect the blood, and the blood was not going to the from the heart to the lungs. So in that way, this line, pulmonary artery line, was closed. And I told you about that one, when a child borns and that cries, and after that was because of the environmental pressure of 480 mmg mercury, 480 millimeter of mercury. And then with that pressure he cries, and when he cries, there are many more things are opening, and just like he cries, the lungs are flattened, lungs are opened, they catch oxygen, they are able to take oxygen from outside, and they are ballooned. And the same way, when they're ballooned, the heart is pushing the blood from the pulmonary artery to that one. So that all these things systematically I have described one and one. But even if anybody wants to get more information about that one at any times, they can call me at 408 687 1899, so that I can tell them individually what their doubts are or what they want to know about this area, so that I can clear them. So this is what in these lectures, though in these lectures, even then I'm taking full time for that one, so that, and speaking with that simple language, so that you everybody can understand that one. Simple language, simple examples. I try to avoid all technical words which we were using in the medical colleges, but we are trying to avoid here, because I know that all of you are not known to the biological words and medical terminological words. So that's why I'm trying to avoid those things. Simple language I'm speaking here. So in this way, we have described how the circulation in the heart was going on. From outside, it is coming through the superior vena cava and inferior vena cava, and also the fresh stuff which is going to be mixed into the blood, that comes from the subclavian artery, sorry, subclavian vein, which is coming in the left subclavian vein from the under the clavicle bone of left side, a vein which is collecting the all constriction, you can say, food stuff, and the quality of the food stuff which is able to be mixed into the blood is collected over there and comes ultimately filled up upward, and ultimately under the clavicle left side, there is a vein that is known as a subclavian vein, left subclavian vein, and it is mixed into that, and that subclavian vein also goes to the right atrium. In this way, every day, every time, every minute, new blood is forming. Blood already is getting the food materials, whatever we are eating or drinking or whatever, from that one, the squeezed material is coming up via the subclavian artery, subclavian veins, to be mixed into the already running blood into the systems. So in this way, all these things systematically, I told you about those one. And then after that, I told you if there be any defect in the aortic artery, the big trunk, big supplier of blood to the whole body, the main you can say. So how the heart is getting blood for its own working, and how this heart is pumping the blood outside, and what's the name of that aorta, and that aorta sometimes may have some problems, just like aneurysm, I have told you, some injuries and all those things. If there be rupture, it's very serious condition, and it takes not that much time to go to the hospital. But even then, if there is aneurysm, there are some chances that yes, you can manage that one, and those serious symptoms I have already told you about that one, that regularly having a high blood pressure, regularly when you wake up, when you rise from the seats, when you start moving, immediately you have pain in the chest, breathlessness and constriction you feel at that time. So all those things I have described systematically, one by one, all concerned with the heart things. And after that, I described you, because the respiratory systems and the circulatory systems, they are the regularly running one after the other, or simultaneously. You can say they are running simultaneously in the systems and without break. Whereas the food pipe has a break. We eat food on certain occasions, 2 or 3 times a day. Maybe with the drinkings, maybe two or three times more drinkings, you can take that one. But that portion of the esophagus, that's a flexible portion, flexible food pipes. This food pipe is pushed towards the side, so that the respiratory system can go normally, that the circulatory system can go normally. But if there be any problem, they are having accumulations over there in the vena cavas, from upward superior vena cava or downward from the inferior vena cavas. This esophagus was pushed to the sides, so that the collection or congestion in between these two major important blood vessels could be adjusted in the mediastinum. but that's painful. That's not always normal. That feels constrictions. That feels fullness over there and heaviness you feel in the chest, all those things. But still, there were some other symptoms I told you. Dizziness, weakness, alteration of the pulse on both arms, blood pressure, change of blood pressure on both arms, and vanishing of the pulse in the lower extremities, the femoral artery in the guinar area, and also in the you can say the malleolus side, the lower portion of the leg. So in this way, ankle side. So in this way, these are all other symptoms with the swelling, heaviness. All these symptoms I have told you about, they are connected with the circulation. When there is any problem in the circulation, these symptoms may come up in the swelling of the face. And if there is a problems in the superior vena cava and that has been blocked, and then there is a congestion in the brain, and automatically the brain function will be lost, and there will be dizziness and unconsciousness and the closing. That means the lids of the eye are closed automatically, and person is not able to open their eyes. He use forces to open the eyes. He cannot, because they becomes heavy because of the pressure, backward pressure in the superior vena cava, which is bringing blood back from the brain. And if it's not coming, bringing normally back, there is some obstruction in the way anywhere because of anything, maybe swelling, maybe big infection, bacterial infection, this and that, or maybe injury, maybe swelling to the allied organs, side by organs. Ultimately, if it happens, it produces dizziness, it produces weakness, it produces fatigue, it produces swelling of the face, it produces stoozing, mean the lids you cannot open that one. So all these things I have described in my previous lectures. But today, it is the time to go. But remember this one. Does not mean that I have covered everything, all the diseases of the heart. No, not at all. All the diseases of the esophagus, not at all. All the diseases of vena cavas, superior or inferior vena cavas, or other musculatures which are covered into the this mediastinal portions, we have to still go for that one. But these are the introductory lectures of the areas, just like the area of head and neck. We have described what are the organs over there, what are the main important symptoms over there if they are affected, what are the organs in the neck, and what are the symptoms if there be any problems in the neck area. Then we came across to the chest, and we have described about that one, that the chest is separated from the abdomen. This whole thing, chest and abdomen, both are known as a trunk, and the trunk is divided into two portions. Then we started describing about the chest area. We discussed about the cage which is formed by the ribs, backside vertebral column in front of the sternum, and how the sternum is joining the ribs with each other, about the joints, how the ribs are at a equal distance from each other, what are the intercostal muscles, how many ribs are attached to this sternum, and the other ribs, how they are arranged in the chest. All those things I will describe about in my previous lectures. And then after that, we discussed about the heart and lungs and its blood vessels, circulations, that things for today. But all these are the simple lectures. All these are the simple lectures because there are many more diseases. Suppose if we'll start only the heart diseases, it may take many months to describe all the diseases. There are many more diseases. In this way, I'm just giving short description and important type of the sickness, diseases of the organs, and main reasons behind that one, and the main thing which we can do to help all these type of things. This is what I'm describing. But ultimately, when we will complete the whole body in this way with the introductory lectures, ultimately we will start one by one to discuss about the diseases of single areas, brain areas, how many organs are there, and how they are affected, and what are the names of those diseases when they are affected. All these things I will describe one by one later on. But at this time, we are uh, at the level to discuss about the lungs. Very important organs, very important organ of our chest and also life, no doubt. Heart is the food supplier. You can say it's a finance minister. It's a finance minister. But that finance minister is dependent upon the person who is making the checks, and who is making the checks and adding money to the checks. Finance minister is having money, but that money is dependent upon the lungs, how much oxygen it has taken, how much food material it has taken. Then it depends upon the lungs how much it distributes, add to it. So this is what you can say, the lungs are more important. If they will not fill up the checks, how much money should go, how much oxygen should go, all that one, then ultimately the blood will, the body will be same divide of oxygen, divide of food materials, and with that there will be anemic condition, and ultimately peoples will not survive for a longer period if they are not supplied with the normal quantity of oxygen and food material. So these two organs are main important for this thing. Whatever food material is coming to blood, that is mixed into blood, and then goes to the lungs, and then lungs has to collect the oxygen from the outside, and to expel out the carbon dioxide and other notorious gases from that one out. And the process for that one, I told you, it was very easy, very simple process, not that but complicated. That all the gases which are coming from all these cells with their garbage, because all these cells are using food materials from the blood, and also they take oxygen from that one, and then returning blood is collecting the garbage of that cell. Every cell of the body, trillions of cells, every cell send their garbage into the back going blood circulation, that is the venous circulation. So in the veins, when they are coming back from the any cell, and collecting the used blood, that used blood contains itself the gas, notorious gases, carbon dioxide and all other things, and the other garbage things they are collecting from the cells and go back to that one. So this is the routine process I have told you about that one. And all these gases, when they whatever they are in the garbage, coming to the heart, and then from the heart it goes to the lungs. All these things is lighter in weight, whereas the oxygen which is coming through the nose or from the mouth, even sometimes it goes to the heart, and then it is mixed with the blood, and from there it is going to the lungs. Means all that one, all that one is exchanged into the lungs. Heavy oxygen coming from the nose and mouth directly into the lungs, sit down in the alveoli of the lungs, and the carbon dioxide and other light gases, they comes out. So with the process of respirations, this exchange takes place, and it's very easy thing. There is no a difficult process which we can explain. That the simple thing, blood collected from the heart into the lungs has a waste materials and gases, has waste material and gases. Gases are lighter than the oxygen. Our life depends upon oxygen. and oxygen from the environmental air is going through the nose to the lungs. Automatically, that takes place. That exchange takes place. Just like you can imagine that the heavy oxygen sits down into the alveoli, and thereby the lighter carbon dioxide and other nitrogenous gases goes up. And with the regular respiration, inspiration and expirations, that goes outside. So it's a normal process. So this is what I have explained you, that this is what going on in this chest area. And today I will describe you about the lungs. I will describe you about the other organs, but this thing, the important organs of the chest is a lung area, which cover most of the part. The maximum area is taken up by the lungs in the chest. I will try to explain it in a simple way so that you can understand. First of all, chest case, you know that, need not to explain that one. Inside the chest case, there are two lungs, one on the right side, one on left side. And the lungs are covered by a membrane, double-layered membrane. Double-layered membrane that is known as pleura. And pleura has a double layer, as I told you. One is known as parietal, that's the outside, which is attached with the inner linings of the ribs, or inner lining of the intercostal muscles, muscles which are in between the ribs and binding the ribs to an equal distance to form the chest case. So one membrane layer is attached to those ribs, but separate to that one. And the other layer is attached to the lungs itself. And the outer one, which is attached to the ribs, that is known as parietal. Periphery, just like you say, the periphery. This is the, in the village, there is a periphery, the outward boundary. And the other one is known as the visceral. Inner layer is known as the visceral. Viscera means organs. The inner layer is attached to the visceras, and that is visceral layer. And that is attached to the lungs itself. But one thing, this inner layer, as there are different sections in the lungs, the right lung has 3 lobes. First of all, if I tell you the size wise, the right lung is little smaller in height. Lungs is smaller by height because it is having liver on the right side, and liver goes inside the ribs. That is why maximum portion of the chest is taken up by the liver. So he is having their accommodation over there. That is why the right lung has smaller in height but wider in breadth. And this right lung has 3 lobes, means 3 different sections. And each different section is separated by this visceral pleura. Understand? Each section of the lung is separated by the visceral pleura, visceral layer of the pleura, so that the fluid which is circulating in between the visceral and the parietal pleura should go in and facilitate the movements of constriction and relaxation, dilatation or constriction of the lungs, because with the breathing, they are dilating, they are constricting, they are dilating, they are constricting regularly. So that should be facilitated. They should not crushed. They should not have any problem to enlarge when the breath goes inside, and they should not have any problem when the breath goes outside. So, parietal layer is going outside, visceral layer is inside attached to the lung mass, and the lung mass is divided into three portions on right side. And if the lung portion is divided into three portions, the inner layer, which is attached to the lung mass, goes inside the lobes and separates the lobes from each other, so that there should not be any problem. Sometimes there is one lobe is affected, sometimes there is a other lobe is working, so they should not be having any problem in this way. And frictions, it saves that one. And moreover, the parietal layer, which is the outer layer of the lungs, that also saves friction. When we expand, when we inhale, take long breathe, lungs flattens, and ultimately they are touching to the ribs, but there is a membrane, and in between those membranes there is a fluid, and that facilitates the movement. There is no any rubbing or constriction movement. Next thing, I told you about the right lung. Right lung is about approximately, you can say, I think this is not of your more important for you. It is important for the doctors and people's other one. Mostly it is about three lobes I told you, and they shorter in height. Shorter in height. Both the lungs are pink and soft and spongy. Both the lungs are pink, soft, and spongy types. And they there's three lobes, and on the left side, in the left side there is a difference. It has only two lobes, and this area lengthwise a little larger than the right side. Smaller spleen is inside that one, but that is not covering that much areas. But this left side lung having only two lobes, and they are separated from each other, the same by the visceral pleura, same by the that layer of the pleura which is attached with the lung mass substance. And there is one other thing. In the medial side, in the middle side, you can say, on the lungs of the left lung, there is a notched area. There is a notched area where heart is adjusted. Though heart is a part of the mediastinum, and mediastinum is a pathway out of that, from that mediastinum, this heart having more portion on the left side and is covered by a separate layer of pericardium, as I told you, so that the boundaries of the lungs and the boundaries of the heart are separated, and both the layers, pericardium as well as the pleura, they are double layered membranes, and these double layered membranes are having some type of liquid in that, so that there should not be frictions. And the third and important thing is that the upper lobe on left side. I'm talking about the left side lungs. Upper lobe on left side has a type of slit, a piece which is curled like this one, like that's right finger from left to like this one, which is covering the ventricle side of the heart. It covers the ventricle side of the heart. This is known as lingula. Just like you can say the tongue. Lingula, just like tongue, our tongue, and it is protruded, and this like left upper lobe has a portion which is known as lingula and extended like a tongue and covers the left side of the heart so that it is have a second type of protection, so they are not frictions with each other. But I told you lung mass and the heart mass, they are separated by their own separate coverings. Heart is covered by pericardium, lungs are covered by pleura. So in this way you can say that they are not causing any problem to each other, but when they are sick they cause. When someone out of these two is sick, that cause problem to the other adjoining organs inside that one. So first thing I told you about that one, that the right lung is having three lobes, left lung is having two lobes, but this is the additional lingula, these additional slit type things along with the heart to cover the ventricle side of the heart, left side, not ventricle, left side of the heart. That's also a part of the left upper lobe. In this way, shape, if I consider the shape, a spongy type, soft hai, this is what I have already told you about that one. Shape is a conical type. It's not globular. It's not round, just like the chest cage. We see that it's all around. No, because many other organs are also adjusted in that. In the diaphragm, under the diaphragm, there is a stomach. That is also having its shape like J, letter J of the English. So in this way, that is adjusted in the epigastric areas. Left side, the spleen is adjusted in the ribs. Right side, the more portion of the liver is adjusted in the ribs. So they are having from downside dome shaped and the wider base of both the lungs, and when they go upward, they become conicals. Means the top of the lungs, right side and left side lung, they are conical, and as they go down, they become a little wider. But I told you, because of the liver on right side, the major portion is outside, the big organ in the right side. The right lung is smaller in height, and the left lung is a little more in height, but that is more thin. Right lung flattens upward, but downward, because of the liver, its boundary is limited. On the other side, the small spleen portion is there, but even then, the lung portion is more longer than on the right side. So lung is more longer as compared to the right lung, and it has a thin, okay, narrow space, because there is a heart on the left side. So these are the main important things I can tell you about this one. If I say with the position of this one, they are filling maximum portion of the chest, and on right side and on left side, but both the lungs are cooperating with the additional organs, and they adjust them in their space, just like I told you, heart. Just like I told you, the mediastinum in the middle. And underneath, it's a dome shape because it hosts the liver on right side and spleen on the left side. Both the lungs are having dome shape from the base and cone shape at the top. Okay. Then lobe, I already told you about that one. Covering, I already told you about that one. The covering, the known as pleura, and they are having double layer. Color, I already told you, it's a pinkish type of color, but that's not of your importance. That's the importance of autopsy or biopsy. Those who does, it's a concern for the doctors. Okay, basically. But even then, I'm telling you because I know about that one. That it's this kind of colors, and the purpose of this one, you can say the apex base, basically why it is the dome shape, because there is other organ it is adjusting. It's giving space to the liver, it's giving space to the spleen, and the left lung is giving space to the heart. So in this way, both the lungs are cooperating and giving space to the mediastinum. And in the you can say the middle, in just in the back side of our sternum, you can say the back side of sternum, you can say known as hilum, that portion, that's known as the medial side. Medical terminology, it's known as medial side. Yani whosoever is close to the center, that is known as medial side. Or they are considered as proximal and distal. Distal is away from the center of the body, and proximal means the closer to the center of the body. Just like when you measure a distance from city to city, that is considered from the city hall. Distance is measured from the city hall. The same way, this center is considered the heart. So it is taken as a center, and the center line, anything which is closer to that line, that is known as proximal, nearest, and which is away from that one, that side, that thing is known as distal. Just like fingers are distal from the shoulder, is a medial side. So in this way, lungs, the left side or the outer sides, are known as distal sides of the lungs, or the lateral sides of the lungs, and the inner side, which is just in the back of the sternum, that these are the medial side of both the lungs. And I'm telling you that in the medial side, the portion is like an arch. Portion like an arch, and that facilitate, or you can say the accommodate, the blood circulation, blood vessels, they are passing from that hilum. This is known as hilum. Notched portion or curved portions from the center, so that it can facilitate to pass the blood vessels, aorta, vena cavas, superior and inferior vena cavas, nervous systems, and all that. They are going to the heart, they are going to the lungs, and they are passing from upward to downward to the down areas. In this way, from the middle side, from both the lungs, these blood vessels are going in, going out, and that area is known as hilum. And in this way, now I think about the structural formations outwardly. This is sufficient information that lungs are two. Right lung has 3 lobes, but height wise is smaller. Left lung has 2 main lobes, but one small lingula, which is covering the hard sides, but that is a little bit long in height. Both the lungs are conical from the above side, just like a gumbad in the religious places, and downside, they are like dome because they are accommodated here, the liver, and on the other side, spleen. The base is wider. Okay, so this is about the things I told you about that one. Now we will enter into it. Now we have given the outward description of the lungs. They are spongy, they are pinkish in color, they are soft. These are two. These are, you can say the shape is conical, you can say that. Okay, and it has a top summit and base downward, and description of the base I gave you, and the boundary outward I gave you, and boundary inward I gave you. What is the importance of the inward boundary? That is known as the hilum, and hilum accommodating main blood vessels which are entering into the lungs, which are going out of the lungs. All those things, circulatory blood vessels and nervous system, and what else, they are going out of that one. Bronchial respiratory tubes are going in and going out. So all these things, we have structurally given you the information about the lungs. Now, the structure wise, the inner structure of the lung is known as bronchial tree. It's just like a tree. It's known as tree because it's just like a tree. You see one stem going, then branches, then leaves, all that, everything they are scattered like just like my fingers. Arm, palm, and then fingers. In this way, the structures of the lungs inside is known as bronchial tree. And upward, this bronchial tree starts from the trachea in the neck here. From trachea, the larynx, which is coming back from the nose downward, that's known as the larynx. When it enter into the epiglottis area, it exchange the way with the pharynx and larynx. They exchange their way, and downward their name is bronchus. Larynx name is bronchus, and the pharynx name is esophagus. And I told you about these esophagus, and I told you about the larynx. So about the larynx, I am telling you, when they from the trachea downward, it goes to and travel downward up to the lungs, and functionally it it fill up the purpose of respirations and supply the oxygen to the whole body and take the gaseous garbage out of that one. This is the purpose of this one. So first thing which I told you, after passing from the trachea downward, the first portion is known as bronchi. Right bronchus, left bronchus. So that bronchi after the trachea has a, you can say, the portions right side and left side. So though it has divided into two portions, right bronchus and the left bronchus, and they are entering into the lungs, right side and the left side. They are entering into the lungs, and then bronchioles, they are just like I told you, this hand, arms, bronchus, and bronchus are two. These are two, and these two bronchuses are right and left bronchus, and left and right bronchus are converted into bronchioles. All these things, right side and left side. Just like a tree has branches, stem is one, then branches and leaves and everything like that one. So they are expanding in this way. Then these bronchus becomes smaller air tubes. They are converted into air tubes. These, just like fingers, you can say, they are converted into smaller, tiny air tubes. And at the end of these air tubes, there are bubbles, just like leaves. Branch is going, it's thin. First of all, the stem, then big branches, then small branches. Then you see the leaves on that one, and leaves are flattened. Leaves are more flattened than the its branch, from where its root, you can say, is coming first. So these branches are converted into alveoli, and you can say these alveoli are in one lung approximately 300 to 500 millions. You can imagine, too much. Alveoli, these are like bubbles, like bubbles, and these are the portions where blood is collected, which is coming from the right ventricle of the heart via pulmonary artery, and that pulmonary artery is divided into two portions to go to the both lungs, and then ultimately it has again branched to match with the alveoli, and they supply that blood to the alveoli. So heart coming from blood coming from the heart, which blood coming from the body was going to the right atrium, it was going to the right ventricle, from right ventricle it is going to the lungs, and lungs are two. It means the pulmonary artery is divided into two. It goes to the both lungs, and the both lungs, when it goes into the both lungs, it is converted into arterioles. Similarly, branching like tree. Similarly, branching like I told you about this one, respiratory tree or bronchial tree. In this way, this is also converted and enters, or you can say the united with the alveoli. And when they are united with the alveoli, blood coming from the heart, and again, blood coming from the heart through the pulmonary artery is going to the alveoli. Tiny branches, but they are balloon type, just like the leaves are more larger than the backside leaf and stem. So in this way, when the blood goes over there, and also air is coming through the nose from the larynx to the bronchus and bronchioles, and ultimately the end product is the alveoli, and it goes over there. In other words, in simple word, just to let you know, it's mixed with that one. When it is mixed with that one, and ultimately the higher, lighter portion of the garbage, blood coming from the heart has a garbage, and garbage is having different kind of garbage, but mainly the gaseous type of garbage is going out from alveoli, and the air which has come from outside environment, that's heavier, oxygen is heavier than that one, that goes into that one, and automatically from the hemoglobin, red blood cells, RBCs, which is inside the blood, RBCs shed off carbon dioxide type of gases, and oxygen is filled into that one. Then that blood ultimately goes back from, because every alveoli is attached with the venous structure, and every alveoli is attached with the arterial structures. So pulmonary, here there is a difference. Pulmonary artery is a artery, though whether it is having you can say the used blood, deoxygenated blood, but the four veins are released, from two from right side, two from left lungs. Four veins are passing out from the lungs. Everything goes from the hilum. Remember, Everything goes from the hilum of the lungs, from the middle side, and they are going to the left side of the heart, and these are known as veins, though they are containing oxygenated blood. So oxygenated blood means one type of garbage has been removed. Gaseous type of garbage has been removed from the lungs, from the blood via the lungs, and then it is still having the garbage, because every organ, just like the when it will easy thing, when it will go to the kidney will also filter it, and the uric acid and many other things it will release from there. It will go to the skin will remove most of the portion of the garbage out of that by the name of sweating. So in this way, every organ has its own duty to clean the blood, take their own portion of blood for the food, for the oxygen, and take the some of the organs are taking the garbage and has the responsibility to shed off this garbage out of body, just like the urine, just like the sweating, just like the breathing. All these things are releasing the garbage by one or the other way. So this is what I told you. Still, there is a long way to go by the lungs, but even then, in short, we have given you the explanation of this thing, that the lungs are two on both sides. Their structural formations, their inside formations, and what they do. I have explained you about that one, and after that, their work is over. After that, it will come to the disease sectors. So, what are the diseases that may be affected? What are the problems in function? Is this one, and in this function, what are the hurdles? What are the problems that this function is not performed normally? So that we will discuss later. So today, my time is over. I am your host, Gurdeep Singh Sandhu, homeopathy consultant, and my clinic address is 9701 Sarah N. Court, Dublin, California, 94568. Phone number 408 687 1899. Anytime when you are suffering from any disease at any age and you need second opinion of your disease, you can call me at 408 687 and 1899. You can get your best opinion of my 52 years based experience. And even if you want to be treated by homeopathic scientific approach for your disease, yes, even then you can contact me at 408 687 1899. God bless you all. We'll see you tomorrow at the same time. I think tomorrow this lecture will be in Punjabi or Hindi. And Radio Pravaz will be joining us with that one, and Radio from the Carolina. They also will be joining with us for the Punjabi or Hindi programs. So please remain attached. And if ever you see you are getting some knowledge about your body, about your functioning of the body, convey this message to your nearest and dearest, so that they can join us on Facebook, Gurdeep Singh's Facebook number, or the YouTube channel. I have a YouTube channel. They can join me, so that if they do not have time at 5 to 6 California Pacific time, they can listen these lectures on YouTube at any time. And also they can join Sabarang Station, sabarangstation.com. That is my own radio, which is running since 2012. And Sabarang radio station runs from 6:30 a.m. Around the clock, has different programs, entertainment programs, Gurbani programs, and all the skits and very interesting things. And between that running programs from 5 to 6, I comes to your society and deliver you the health education lectures, so that you can be aware of your body, functioning of the body, and how it becomes sick, and how, if it's sick, how you can get rid of these problems. I'm just telling you the simple things so that you can understand. It's not only that the doctor can understand, but yes, most of the things, initial stages of the disease, you can understand that one, and that's very easy at that time to manage the things. So God bless you all. We'll see you tomorrow from 5 to 6, California Pacific Standard Time. Sat Shri Akal, Adab, Namaskar.